Hi everybody, good to be back with you. My name is Dr. Scott Keller from Synergy Chiropractic Spine and Joint Center. We're located on 56th and Pine Lake in the Madonna Proactive building. And we're going to continue on our journey kind of up the body here. Last time we talked about some glute activation exercises to help kind of with the hip and the knees from crashing in and out, what we call valgus load on the knees. This week, what we're going to do is some posterior chain flossing. So what that means, the posterior chain basically is you can even go up through your spine, through your glutes, hamstrings, and your calves, all right? So that back side of our leg does play a vital role in proper function. A lot of people feel like their hamstrings are just always tight. If anybody has ever had a condition such as sciatica, maybe some issues with sciatic nerve, numbness and tingling, some of those kind of things, sometimes this kind of therapy or technique can be beneficial as well. As usual, disclaimer with this stuff is if anything's ever creating pain or you know you have an issue that you're hesitant to do this kind of stuff, I would hold off and get a hold of your medical provider or someone like ourselves, and we can kind of work and coach you through it. So one thing I do want to mention before I get into the exercises is if you feel like you're chronically tight on the back side, don't just make the error of stretching just the hamstrings, okay? We're not going to go into it today, but one of the most important structures for the back side as far as tightness and chronic issues back there is the front side. So that might surprise a lot of you, but a few structures on the front side, most importantly, would be the iliopsoas muscle, which is the primary hip flexor muscle that drives your knee up and your hip into flexion, and also the quad muscle called the rectus femoris. The main quad muscle from your knee all the way actually crosses your hip joint and also is an accessory hip flexor muscle. There are others, but those are the two primary things that I'm going to just touch on here briefly. What those muscles do and how they affect the posterior side in the hamstring is basically the way they attach to your pelvis is they can rock your pelvis forward into an anterior tilt if they're really tight. Who does that happen to? It happens to a lot of us. A lot of people who sit a lot during their day. So if you imagine being in a seated posture with your leg up in this position, these muscles on the front side are in a shortened position all the time. And unless you've been actively stretching them through your desk job career, they're probably going to be short, tight, and compromising your pelvic position a little bit. So how does that, again, play into the backside? When you have this this anteriorly tilted pelvis, if you picture where your hamstring attaches back here, which is right on your kind of sit bone or butt bone, if you rock your pelvis forward, that point raises up towards the ceiling, which actually puts a stretch on your hamstrings. So the hamstrings will always feel tight, right? You can stretch and stretch and stretch and mobilize and foam roll and do all these things, and they just never loosen up, or it helps for a few minutes. This could be the answer you're looking for. So make sure you don't forget or neglect the front of the hips, okay? So you can look up or look at some of my other videos from the past as far as hip flexor stretches, quad stretches, or other techniques to help mobilize those areas, all right? But what we are going to focus on today is the backside. So if you actually have some hamstring tightness that isn't just attributed to this forward tilted pelvis, these are going to be good for you. You're going to need, actually you don't need a band, but one of these monster bands that I've talked about in the past are handy to have. I'm going to show these exercises with and without them just so you can kind of gain an appreciation for either one. What we're going to start with is just a simple standing one, and then we're going to lay down and do it on the floor. So from a side view here, the leg that I want to stretch is going to be right in the front. I'm going to get a staggered stance just like this. I like to put my hands just on my hips just so they're relaxed. And a key to this one is not flexing your lower back or your spine down when we bend forward. We want to keep a nice tight engaged core and push my hips back as I lean forward. So really my lower back should stay pretty neutral and shouldn't be affected by this too much at all if you do it properly. So what I'm going to do is tighten my core, lean forward. Once I get to the point where I start feeling a little bit of a stretch through the hamstring, I'm then going to slowly extend this front knee backwards like that. Hold it for 2 or 3 seconds and then relax and push it back again and relax, and just repeat that. And once again, maintain that core stability and tightness throughout the whole exercise. If you do that 10 or 12 times, switch and do the other side, you're probably going to get some good flossing, some good stretching back on those muscles, fascial layers, as well as possibly some of the nerves such as the sciatic nerve. Okay? A way that you can do that laying down, which I tend to like a little better, lay on your back. Again, core activation is important, so tighten your core so your back is flat to the floor. This leg I'm going to have as flat as I can and try to keep it flat so it doesn't raise up like this. I'm going to put my hands right behind my knee or behind my hamstring here. I'm going to first pull up, and that can just stretch the glute and the upper hamstring. Get to the point where you feel a light stretch there. Point your toes up towards the ceiling. Start extending the leg up. You should feel a gradual increase through the back of the knee. Once I get my leg as straight as I can get it, I'm going to point my toes up towards my knee, doing that dorsiflexion motion we've talked about in the past. Hold for 2 or 3 seconds, and then relax down. And I'm going to repeat that whole sequence. So I'm going to pull, straighten, keeping my toes pointed towards the ceiling, and then toes up towards my knee, just like that. Again, try not to compromise the position. I don't ever want to see that somebody's ribs come up or their back come off the ground when they're doing this. I don't want to see this leg come way up. Obviously, if that happens, you definitely have some mobility issues, possibly even in that other hip as well as this hip here. So if you can't get to where your leg is straight and then up like this, just back off a little bit. Go, even if it's here and here or even lower. Whatever you can do comfortably. That's safe, giving a little discomfort but not causing pain. If you start causing any numbness and tingling into your foot, it'd be advisable to stop at that point as well and consult your medical provider or someone like us to help you through that, okay? So, posterior chain flossing without a band, and now all I'm going to do is show you another way, a little bit more invasive of a way to do it if you do have a band, which can, again, just be a little more effective. So, you're going to put that band against something that's not going to move, okay? You're going to wrap it right up in your groin or the top of your hip. Now the purpose of the band is to traction your hip in a posterior direction, so backwards. So it's kind of taking that ball in the socket and pulling it back just a little bit to get a little bit more of a stretch back here. So you're going to step out so there's quite a bit of tension on the band, and then you're going to repeat the same thing. So tighten the core, lean forward, and then straighten the leg like that, okay? Same thing, adding the band. Same thing with the one on the ground. I'm going to lay down, put the band, once again, up high in the groin. Other leg is flat. The band is pulling that way with some tension, and then I'm going through the same exercise, straight, toes pointed, and then up like this. Relax, pull, point, and up. Okay? So again, 10 or 12 repetitions per side. You can definitely do multiple sets of each one of those until you feel like you got some good motion, some blood flowing on the back of those legs. All right? If you guys have any questions, please don't hesitate to call 402-328-2660. Email me, scott@synergylincoln.com. And I'd be happy to help any of you guys out, give you some advice, point you in the right direction. All right. Thanks, and until next time, good luck.